Welcome to this pharmacy student edition of Promoting Quality Patient Care. This presentation addresses the topic of taking anti-inflammatory medications safely. Anti-inflammatories are one of the most universally used pain relievers. A class of anti-inflammatories are known as non-steroidal anti-inflammatory drugs, or NSAIDs. Anti-inflammatories are most frequently used to treat pain from arthritis, headaches, migraines, or period pain, to reduce fever and inflammation, for blood thinning, post-operative pain, or musculoskeletal disorders. Anti-inflammatories all contain active ingredients. The active ingredient is the ingredient of the medicine that allows the medicine to have an effect in the body. Different brands of anti-inflammatories may use different active ingredients and may use more than one active ingredient. Consumers may also choose whether they would prefer to receive a generic brand of medication, which is usually cheaper than branded medicines. Generic brands are usually known by their active ingredient name. Not all anti-inflammatories are the same. They are classified into schedules according to the level of regulatory control over the availability of medicine or chemical. This is required to protect public's health and safety. Schedule 2, or S2 drugs and poisons, otherwise known as pharmacy medicines, are for therapeutic use and are for minor ailments or symptoms that can be easily recognized by the consumer and do not require medical diagnosis or management, for example, Voltaren 12.5. Schedule 3, or S3 drugs and poisons, otherwise known as pharmacist-only medicines, are for therapeutic use and are for ailments or symptoms that can be identified by the consumer and require pharmacist verification and advice, for example, Voltaren 25. S4 drugs and poisons, otherwise known as prescription-only medicines, are for therapeutic use and are for ailments or symptoms that require professional medical diagnosis, Voltaren 50. PBS stands for Pharmaceutical Benefit Scheme. It has been designed to ensure all Australian residents and eligible overseas visitors have access to necessary and life-saving medicine at an affordable price. Around 80% of prescriptions dispensed in Australia are subsidised through the PBS. If consumers choose generic brands of medication that are on the PBS, this makes it cheaper for the government and in the long run will lead to more funding to add other medications to the PBS. Be aware that if large quantities of medication are packaged, they move across the schedule table. For example, a pack of 30 Voltaren 25 tablets are pharmacist-only medication, but a pack of 50 requires prescription. Most individuals can take anti-inflammatories with no side effects. However, it is possible that some will encounter complications such as dizziness or headaches, nausea, excess gas, diarrhea, constipation, extreme tiredness or weakness, dry mouth, or bleeding. More serious side effects, particularly as a result of long-term use, can include kidney disease, elevated blood pressure, muscle cramps, hearing problems, or damage to the stomach and small intestine lining that can lead to ulcers. Some people have serious risk factors that make it inadvisable to take anti-inflammatories. These include asthma or allergies to the active ingredients, cardiovascular conditions, cerebrovascular conditions, gastrointestinal, including active peptic ulcers or gastrointestinal bleeding. Fertility may be impaired in women who are trying to conceive, pregnant women, and breastfeeding mothers. Many consumers who are unaware of the adverse effects and the contraindications of anti-inflammatories rely on advice from pharmacists. This makes it critical that pharmacists are regulated, follow standards of practice and codes of conduct. There are several pieces of legislation and policy which a pharmacist may refer to in the case of supplying an anti-inflammatory to a client. Legislation is a legal document and illegal acts can be punishable by law through monetary fines or even jail time. Policy documents are not legal documents, but these may be referred to in court as representative of good practice. The law will always take precedence in court. These are relevant legislation that a pharmacist should be familiar with to guide his or her conduct in supplying medicine. The main purpose of the Health Professionals Act is to protect the public from harm and to ensure that health professionals are competent to provide health services. As a pharmacist supplying an anti-inflammatory to a client, this Act states that you must meet a certain standard of competence set by the Pharmacy Board of Australia, and anyone may report you if they feel that you are not meeting this standard. In conjunction to this piece of legislation is the Health Professionals Regulation, which outlines that a pharmacist is responsible to be registered with the board in order to practice. This Act is important for a pharmacist to know their legal responsibilities in relation to the sale of medicine. Pharmacists are responsible for providing adequate information to the client so that they use the medication correctly and safely, and they are provided with the most appropriate type of medication. The Act also covers offences related to the supply of medicine, such as incorrect labelling, storing, record keeping, and supplying to the incorrect person. It is also useful for the pharmacist to be familiar with the Medicines, Poisons and Therapeutic Goods Regulation 2008 and the Community Pharmacy Code of Practice 2012 ACT, which references have been provided for in this presentation. Now let's take a break from that legal stuff.
And why does that pharmacist have to be 2.5 feet higher than everybody else? Who the hell is this guy? Clear out, everybody. I'm working with pills up here. I'm taking them from this big bottle, and then I'm going to put them in a little bottle. That's my whole job. I can't be down on the floor with you people. Yes, I'd like to get this prescription filled, please. All right, but you wait down there. No one comes up here but me.
Back to that legal stuff. There are also several policies that as a pharmacist you will need to be familiar with. The Code of Conduct sets out more general guidelines and standards for health practitioners to maintain professional behaviour and conduct and ensure their duty of care to the clients, practice safely and effectively, and maintain high professional standards and competence. The Code of Conduct can be used in court as representing professional practice. This Code of Ethics guides professional practice specific to pharmacy. When supplying medicines, this can be used as a reference in your professional behaviour. These are guidelines for registered pharmacists in professional practice and conduct specifically related to dispensing medicine. This is a really important document related to safe dispensing and labelling of a medicine and providing a good pharmaceutical service, and can also be used in court as evidence of professional practice. An important document to inform best practice for supplying anti-inflammatories to clients. The National Medicines Policy describes access to safe, quality and affordable medicine and responsible use for quality health outcomes for the Australian public. Pharmacists can gain a better understanding of their role in terms of medicine supply at a national level and in relation to other bodies like government, the pharmaceutical industry and the consumer. Let's look at an example of how pharmacists can dispense anti-inflammatory safely. We will follow the stop and go protocol while we role-play dispensing Voltaren 25, a Schedule 3 pharmacy-only medicine.
Hi there, how may I help you?
The pharmacist observes that the client is a mid-20s female of athletic appearance.
Hi, my physiotherapist asked me to come and chat to you about which anti-inflammatory I can take to help with my sprained ankle.
Okay, I can help you with that. How long ago did you sprain your ankle?
Oh, just yesterday morning.
And is there much pain or swelling?
Yeah, it's quite swollen and it is still quite painful.
Are you taking any medications for this or any other conditions?
No, none at all.
And do you have any reason to believe you might be pregnant?
No.
Have you ever taken anti-inflammatories in the past?
Yes, I took Voltaren 50 when I sprained my other ankle about 2 years ago.
And did you have any negative reactions then or to any other medications?
No, never, but I did find that it helped with the swelling.
Okay, and did you experience any stomach upset?
No, not at all.
Okay, I'd recommend Voltaren 25, which will still reduce your pain and swelling, but with less risk of side effects than Voltaren 50.
Okay, that sounds good.
We do also stock a generic brand that does contain the same amount of the same active ingredient, and it is cheaper. Are you happy with that?
Yeah, of course.
With this one, take 2 tablets initially, followed by 1 to 2 tablets at 8-hourly intervals. Do not take it for more than a few days at a time, and do not take more than 8 tablets within 24 hours. Now, because you didn't have any stomach upset last time, you should be fine to take it with a glass of water before a meal, but if it does upset your stomach, try taking it with a meal. If your symptoms persist, see your doctor or physiotherapist. Don't stress out about remembering all of this because it is written on the side of the pack for you just here. I've also included an information sheet for you. Do you have any other questions?
No, that sounds great. Thanks very much for all of your help.
For further information, please refer to our references.